There's a lot of controversy about bipolar disorder in kids. The research literature says that if you look at depressed kids who are depressed probably before adolescence, the likelihood is that ultimately they will go on to develop what is recognizable as bipolar disorder, about half of them down the road. So often in kids it shows up as just simply depression. Often it shows up as conduct disorder problems, either at home or at school, especially temper problems that are difficult to control. It may look like ADHD, but unlike ADHD, which is generally there all the time, bipolar highs come and go, and when they're gone for a while. And so they may show up like difficulty with attention or fidgetiness or hyperactivity and the like. In general, we think that if somebody has their first episode of depression in their teens or earlier, maybe a red flag that they may be in the future at risk of developing what we now call bipolar disorder. Having said that, I think the diagnosis of bipolar disorder, which is a serious diagnosis, needs to be made by a mental health professional who spends enough time with the patient and the family to really make that diagnosis appropriately. I see, for example, kids whose only real symptom is they lose their temper a lot. Well, losing your temper is not that unusual these days in the United States. And if that's the only symptom they have, then it may or may not be bipolar disorder. It may be a conduct problem. It may be a stress problem. It may be depression or something else. So I think the diagnosis of bipolar disorder needs to be made after looking carefully at one's symptoms as well as one's family history.